Hi, my name is Dr. Daniel Fox. I'm a licensed psychologist in the state of Texas, and in this video I'm going to talk about free-floating anxiety, or what is also called generalized anxiety disorder, and how that relates to borderline personality disorder. And in this video we're going to talk about what those different factors are, how they relate to borderline personality disorder, and then I'm going to also suggest some tips and methods that can help you to sort of manage this, as well as talk a little bit about a technique in a video that I made on a technique that I use with a lot of my clients that I call ACT. So let's start out first with identifying and describing what is generalized anxiety or free-floating anxiety. So generalized anxiety disorder, this is excessive anxiety and worry that occurs more days than not, okay? And it has to occur for at least 6 months. So there has to be a little time frame in there. Okay, and it's about a number of events or activities, could be work or school performance and things of that issue. Now, this is often seen in individuals with borderline personality disorder, as well as those with borderline personality disorder traits, due to the uncertainty about their own efficacy to sort of control their life and how their life is unfolding and how much control they have over it. It's also important to know that the source of your anxiety, it's important to identify that what's driving that free-floating or generalized anxiety that you're experiencing. And for individuals with borderline personality disorder, that a lot of their anxiety sort of stems from a lot of their issues with themselves, as well as with interpersonal concerns. And a lot of times, though, it's unidentified, is that you see that these folks are nervous and anxious and worry about something. Something feels not right. Something feels off. Something is making them very worried, concerned, and feeling overwhelmed. Right? Now, the next criteria is that the individual finds it difficult to control the worry. Now, this is where that ACT technique can really help. There are many different types of anxiety techniques that are very helpful, that have been found to be very, very effective to control a lot of these worries. And now, without these skills, though, I think that it's unfair to have the expectation of yourself that you will just know how to control it. It's a skill, like origami, right? We don't just wake up one morning and we know how to do origami. It's a skill. It takes time. It's something you have to study and work on. And I think anxiety is the same thing. We can't just use anxiety techniques when we're anxious or when we find it difficult to control our worry. We have to use these techniques every day. We have to build up that skill. So when we do experience a lot of anxiety, we're ready for it. We're ready to control it. We're ready to contain it. Okay? So that's really important as well. The next criteria is that the anxiety and worry are associated with the following symptoms. Now, at least some symptoms have been present more days than not for at least 6 months. So we're going back to that time criteria, because that's critical for a disorder or a diagnosis, is the time period. Now, a lot of different disorders have different time periods. For this one, we're talking about 6 months. And that's a really long time to have this. And what we see is, and some of these different factors, and we're going to go over those in just a second, is that they're present for a really long period of time. And individuals with borderline personality disorder, they have trouble sort of discerning those. Is it the borderline personality disorder, or is it the anxiety? Is it the chicken, or is it the egg? Well, which is it? And that's what's so important, I think, about this video, is to try to reason that out. Is it free-floating anxiety, or is this a byproduct of the borderline personality disorder? So let's get into some of these particular symptoms. Now, the first one is feeling restless and keyed up, right, or on edge. Now, often you see folks with borderline personality disorder that they usually function on the fringe anyway, that they're ready to respond or retaliate in some way. So they're very, very hypervigilant. And this aspect is deeper than just anxiety for those with borderline personality disorder. It's part of their personality. It's always kind of been there as it relates to how they feel about themselves and whatever their core content is. Now, that core content are those issues that are underneath, right, that are inside. And when those get triggered, they set off a response. So when you look at your anxiety, what's driving it? Is it thoughts of being alone? Is it thought of being empty? Is it thought of being abandoned? Though your core content is what is underneath that abandonment, emptiness, fear of being left, whatever it may be. So it's important to know that as well, to try to separate this out. Now, the next criteria is being easily fatigued. Now, an analogy that I like to use is that, so you're trying to swim in the ocean, but the ocean is pulling you the other way. So you try and you try and you try, and you're trying harder and you're trying harder and you're trying harder, but you're never swimming forward. And what happens is and this is like your anxiety, that anxiety is the swimming, and that it's always going, you're always vigilant, you're always aware, you're always on the lookout. Okay? And that is more of a borderline personality disorder issue. But what happens is that you begin to tire out. You begin to become fatigued. The easiest, the smallest things tire you and exhaust you. And that can sometimes cause you to slide into a depressive episode. And depression in those with borderline personality disorder is very, very different. So it's important to be aware of that as well. I'll put a link here to the video that I did on depression and borderline personality disorder, and so that you can have some insight and try to discern that as well. This treatment is very important in regards to that. And so you're easily fatigued because you're always going and you're always on the lookout and you're always ready and you're always ready. And I think that you see that a lot in individuals with borderline personality disorder. What's driving it? Is it just the anxiety, that free floating, or is it that core content, fear of being left, abandoned, hurt, harmed in some way? So it's important to be able to discern that out. Now, the next criteria is difficulty concentrating, or your mind goes blank. Now, the anxiety, it creates this film over your view of the world and your ability to think. And so you're trying to explore so many alternative options to not be hurt, to not be harmed, to not be forgotten, to not be abandoned, that you can't think straight or think of what to do next. And this is your BPD at work. This isn't the response is a free-floating anxiety, is this anxiety, generalized anxiety, which you may have, but what's driving it is that borderline personality disorder. So you can try to lessen that anxiety, but it's always there because that core content is constantly driving that surface expression, which is the free-floating anxiety. Now, the next criteria is irritability. Now, this is very common in folks with borderline personality disorder. A lot of times they have a lot of pent-up rage, and so it doesn't take much for some folks, depending on where you are on that spectrum of borderline personality disorder, to really be set off and engage in maladaptive beliefs, behaviors, and patterns towards yourself or towards others. So this is another one that's really common. And another one is muscle tension. And a lot of my clients that have borderline personality disorder, muscle tension is very, very common. They're often very, very stiff and rigid, and they're just ready for it. Again, this goes back to that anxiety and that hypervigilance, that you're always on the lookout of being harmed. And so that tension can only add to the confusion because it's adding a sense of, like, let's call it like physical validity. So our body is saying, yes, 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 we are vigilant, we're on the lookout, something is happening, and that's sending signals to your brain. Yes, we have to be on the lookout, we have to look for something is going to happen. And what happens is you become more and more anxious, and your body is reinforcing those thoughts, right, which is encouraging those feelings. So it starts to do a cycle and starts to go back, and it can kick off a lot of various responses and sensations for yourself, which then encourages engaging in maladaptive patterns. So that muscle tension is very common. Now, if the muscle tension is just associated with anxiety and not core content, remember, for those with borderline personality disorder, we want to look a little deeper. We want to look and see, what is my core content? What's driving this? Is it fear of abandonment, loss, emptiness, things as we already mentioned, what that core content is? Or is it something? I'm not exactly sure, because I don't really have a concern about abandonment. I don't have concern about worthlessness or loss or feeling invisible or whatever it may be, whatever that core content is. Then that is more of a free-forming anxiety issue and generalized anxiety disorder issue. Okay? Now, the last one is sleep disturbance. Now, a lot of folks with borderline personality disorder have a lot of problems with sleep. And this is very, very common. Sleep is so, so important. It regulates your body, it regulates your brain. It helps you reason situations when you're well rested in a much more effective way. I think we all know that, right? That when you are more tired, you're at a higher likelihood to be snippy. You're more likelihood to respond without thinking because your body and your brain is tired. Now, many folks with BPD don't sleep well, as I mentioned, and this certainly could be its own video. If folks are interested, please let me know. I can do a video on sleep as well as sleep hygiene, if that would be effective for you. I'd be happy to do that. Just let me know in the comments. Okay, but folks with borderline personality disorder, a lot of times they have sleep issues because of night terrors or nightmares or sadness, a lot of rumination, which can present certainly with a lot of free floating and other anxiety issues as well. So there can be a whole host of issues that impact or adversely impact sleep associated with borderline personality disorder. Now, the next factor, this isn't necessarily a symptom, but this is that next factor. And this one is really important because this is what determines, is it a disorder or is it like an issue? Okay. And so when it's a disorder, we're talking about free-floating anxiety, generalized anxiety. That anxiety, worry, or physical symptoms, they cause clinically significant impairment or distress in social, occupational, could also be academic if you're in school, or other important areas of functioning. So it impairs what's called socioeconomic functioning. It causes socioeconomic dysfunction. And this is critical because sometimes if there are issues, right? So remember, 6 months was a big deal, right? Is our range. So if it's an issue, what could be that you're very anxious, like let's say you're in school, you're anxious about a test. Let's say that you're having issues with your marriage and you are anxious about your significant other coming home or your spouse coming home. And so that's anxious. So you're anxious all day because you're thinking about it. And then when that person comes home, you don't have the fight, you don't fail the test, whatever that may be. And then your anxiety subsides or goes away. That's not what we're talking about here. We're talking about socioeconomic dysfunction, is that you are so anxious and that you're not exactly sure why. It's that something, and that causes a degree of impairment where you have difficulty doing your daily task, completing your daily task, taking care of yourself, taking care of your kids. Maybe you're more forgetful. You can't remember things, and you're not following through on the things you need to do daily to help yourself and to help those that are in your immediate circle whom you look after. That's that socioeconomic dysfunction. But for generalized anxiety disorder, free-floating anxiety, what that is, that's associated with the anxiety. Individuals with borderline personality disorder typically have these issues because of their maladaptive beliefs, behaviors, and patterns that is very disruptive to not only their own life, but the life of those that are around them and in different situations. Okay, so there's a big difference there. It's important to tease those two out. So if you're wondering, well, is it the anxiety? So for anxiety, we want to know, is it from core content? Because that would be your personality disorder issue. Or is the anxiety, when you look underneath, what's driving it? And we have to try to figure out what that is. Okay, and that can be really hard to do, especially with that free-floating generalized anxiety. So what's causing it? And what you can do is, if you don't want to try to, or you're having difficulty identifying what that origin is, what that cause is, just learn those healthy coping strategies, right? Try the ACT technique, and that's been really effective for a lot of my clients. And you have to stop feeding the stray cat of anxiety, which I talk about in the ACT video. And it's that stray cat, which is the anxiety, that keeps coming around the house because you keep feeding it. Okay? So check out the video, that'll explain it as well. And it is important for those with borderline personality disorder to use these skills as well, to lessen that anxiety, to do daily mindfulness, to do relaxation skills on a daily basis. It's important not only, and I'll even expand on that, it's not only for those with borderline personality, it's important for all of us. Our life is so fast-paced. It is important to slow down, think, and reason. And that allows us to more accurately determine the outcome of situations, what we can do and how we can influence situations to make it even better. Okay? So I hope that you've enjoyed this video. Please leave any comments or questions that you may have. I try to address all of those as best I can. If you enjoyed this video, please check out some of my other ones. You're welcome to subscribe. That'd be great. And thank you very much for your time and attention. I appreciate it. Take care.